The age of big data is upon us, and we're here in San Diego, California for ASCRS 2023 to talk about how eye care stands to benefit. Patient outcome tracking databases like Rayner's RayPRO Plus look to capitalize on the wealth of data that doctors encounter in every surgery and use it to improve patient outcomes worldwide. Joining us to discuss how platforms like RayPRO Plus are empowering patients and practitioners alike is Dr. Mark Torres.
So I am in a solo practice in Sandpoint, Idaho, and it's primarily a cataract surgery practice, kind of a higher volume cataract surgery practice, in addition to, basically kind of comprehensive global ophthalmology. So the RayPRO Plus platform allows you to really self-assess on several different parameters. You're able to assess the success of your practice. It gives them the opportunity to say the things that they liked or didn't like. So that's valuable. It gives you the opportunity to make changes to that aspect of your practice that's completely independent of the technology that you're using. In addition to that, it then gives you feedback about the actual product that you used for their surgical procedure, gives it to you from a level of understanding that is at the patient's level of perception. How am I doing with my driving? How am I doing in the real world? Which really is ultimately the most important thing to them. The RayPRO platform actually gives you feedback on a scale that's valuable. It's not just the opinion of a handful of patients. In the past, capturing that data has been challenging. Finding a technology like the RayPRO platform to me is extremely valuable, and I would have to say that any surgeon that is looking at outcomes on a large volume scale would want that kind of information and want that kind of feedback and can benefit from that kind of feedback and information. The RayPRO platform is probably one of the first platforms that I've encountered where it actually makes the process of patients responding to the survey user-friendly for them. The more user-friendly you can make the platform for them, the more likely that you are to capture data. I've been surprised at how many patients have actually responded to the RayPRO surveys and have actually inputted their data. So if you now have a platform that you're getting 50% feedback, that's actually quite good, better than most feedback systems that have been out there. So the RayPRO seems to be hitting the mark, so to speak, with patients wanting to input their information and then providing useful feedback. The real quality of a lens like the Ray 1 lens is based on what's the real world experience of the patient, not what you can measure in the clinic. What it comes down to is how does the patient feel that the Ray 1 lens has benefited them on their daily functional visual tasks, their driving, their reading, their occupation, their hobbies. That's been the real benefit. It's more subjective, but still useful information about the Ray 1 lens that allows you to increase your confidence using that lens as a surgeon, and then also selecting a patient population that it's a candidate for the Ray 1 lens. Several elements of data that you can enter, that you can track. It gives you some timelines down the line to actually ask them how they're doing that are both in the short term and the long term. The thing that I've been the most surprised at and the most pleased with is the small amount of near vision that patients are getting post-operatively. So in addition to having a good distance visual outcome with the Ray 1 lens, I'm finding that patients have about +1 of near vision, which is extremely beneficial, especially for patients where their anticipated outcome didn't include that. You'd already sort of prep them ahead of time that they would still need to wear readers or still need to wear glasses. And so then the patients are pleasantly surprised afterwards that their reliance on that is less than what they would have expected and less than I would have expected.